Hello everyone, welcome back to my channel. Welcome to Is Pharmacology Difficult podcast, in that we are going to talk about a single drug in fast pharmacology in just 5 minutes. So today's drug is Arbli or Arbli. So it is, first of all, I should give you an overview quickly. It is basically indicated for the treatment of hypertension in adults and also in children 6 years of age and a little older. And the basic aim of the therapy is to lower down the blood pressure. Why is it so important? Because it lowers the risk of fatal and non-fatal cardiovascular events. What kind of events? Strokes, MI, myocardial infarction. So its dosage form is very important. The administration information, it should be very importantly known. In the oral dosing syringe or the oral dosing cup is there to measure the prescribed amount of medication. The patients should be informed that oral dosing syringe or cup can be obtained from the pharmacy. Then I'll tell you about the side effects, the common one and the severe and the long-term effects. Some general precautions about Arbli. It is very important that the progress should be monitored regularly at every visit. Sometimes there is dizziness or lightheadedness that is reported by the patients. Then if the patient becomes sick, then it should be reported to the doctor quickly. And alcoholic beverages should be avoided, and other medicines should be also consulted with the doctor. Now the less common side effects, they are blurred vision, confusion, itching, pins and needle sensations, difficulty in breathing, dizziness, faintness, lightheadedness, nausea, vomiting, numbness, nervousness, sweating, stomach pain. There can be a lot of tiredness, weakness. So these are the basic headache, etc. These are the basic side effects and common side effects which actually don't need a medication, a real different medication. They can be well tolerated. Now I want to throw a little more light upon the basic information. The indications, as I told you, it is treatment of hypertension, reduction in the risk of stroke, and treatment of diabetic nephropathy with an elevated serum creatinine and proteinuria can also be one of the indications for the use of Arbli or Arbli. It's given once daily orally. The starting dose is 50 mg orally once daily. Later on, hydrochlorothiazide can be added for the treatment of hypertension. In nephropathy in type 2 diabetic patients, it is started with 50 mg orally once a day, and then it can be increased up to 100 mg orally once a day. Now, there is a risk of hyperkalemia, risk of lithium toxicity, and these are the basic risks involved with the treatment of Arbli. Breastfeeding is not advised during the treatment of Arbli. It is not to be used in patients or children, especially less than 2 years of age. And sometimes there is reported hepatic impairment also. So these are the basic features about Arbli. It was approved on March 13, 2025. So you can just imagine how recent drug it is. And it is basically, chemically, it is Losartan Potassium, oral liquid formulation of the approved angiotensin II receptor blocker, and it is used in the treatment of both hypertension and diabetic nephropathy. So that's all about this drug. Now is the time to wind up. I conveyed it nicely to you. And till the next time and the next drug, if you like this information, don't forget to hit the like button. Don't forget to subscribe to my channel. At the same time, stay tuned till I come upon with another new drug. Thank you. Take care. Bye-bye.